While medical technology has come a long way to help babies born early survive, doctors want you to be aware of a disturbing reality. Black infants are nearly 3 times as likely to die as white babies. Our Madeline O'Neill shares why that might be and what can be done. Maddie?
Well, compared to other similar countries, the U.S. actually ranks near the bottom when it comes to babies being born prematurely. We even get a grade of a C- according to a March of Dimes report card. Now, we could also get a C- here in Wisconsin, where the gap between white infants and black infants' mortality rates is the highest.
Do everything you can to save my son.
Despite the numbers stacked against her.
Tamarian was a 23-weeker, so 23 and 5 is when I had him.
Akiko Moffett knew the one thing that mattered was fighting for her baby.
And he was 600 grams. That's small.
Born 15 weeks early in January 2019 after Akiko came in the night before with bleeding and pain. Tamarian was a surprise to doctors, too.
I kind of felt like they didn't take me seriously.
20 minutes after his birth, Akiko was rushed to the NICU.
And they were doing CPR, and he had flatline.
Then a mother's touch.
He grabbed my little finger.
Did something Akiko still has a hard time believing.
His heart started back beating and everything. And I'm like, hold on, little man, just fight. You know, if you fight, I'll fight with you. And he came back to life. But this is him.
Now, the numbers are looking better. As Tamarian hits 22 months old.
He brings so much joy to us. He was the missing link to our family.
But numbers for babies statewide need more attention, according to neonatologist Dr. Ryan McAdams.
These big disparities, they do exist.
Racial disparities in babies born early and infant deaths. In Wisconsin, black babies are about 3 times as likely to die in their first year of life as white babies.
And I think that's the part that is very disturbing.
McAdams says there's no clear-cut explanation, but plenty of potential factors that can affect a mom's health.
Healthcare access, poverty, racism.
Even the kind of health care they receive.
Unfortunately, skin color may influence that, which is sad to hear, but it's also likely true.
Take these women seriously. Even offer, low-cost health care to them.
Akiko knows how much even one nurse can make a difference.
And I've seen what those NICU nurses did for me, and I was like, I need to be that.
So she traded her criminal justice degree for a job as an assistant nurse.
So he just kind of woke up.
On the same floor here at the American Children's Hospital, where her son is currently being treated for dehydration.
I love him to death. He is a fighter.
Akiko is taking part of the fight into her own hands, encouraging moms to advocate for their health and doctors to listen.
Believe in yourself, believe in your child.
Because there's strength in numbers.
Be the open arms, be that village that they need.
Dr. McAdams says reducing that gap and getting rid of it will take more than just changes in healthcare, but systemic changes as far as things as poverty goes. Now, when it comes to Akiko and Tamarian, they hope to be discharged soon, and Akiko hopes to become a registered nurse.
We wish them all well. Madeline O'Neill reporting live tonight. Maddie, thank you.